Can you imagine hearing the news that you may not have long left to live? This information can be very overwhelming, especially if you're told that the time you have will be endured with suffering. This is hard to imagine, yet every day it happens to so many people. Debbie Purdy, at the age of 31, was diagnosed with multiple sclerosis. Kevin Davis, at the age of 60, passed away after he lost the use of his legs to renal cancer. Nigel Pratton had Huntington's disease, which progressed so quickly that he overdosed on medication to end his suffering. All these people have one thing in common, and that's that they wanted the right to die in dignity. People have a right of choice, freedom, and autonomy. I first learned the depth of this debate in my death and dying nursing course, and have recently had a patient at my workplace that was in a similar situation. I wanted to do more research so I could decide for myself what was right and wrong. Patients should have the choice in their care and their outcome, and this includes the option of availability of a physician-assisted suicide. Patients are being turned away who make this choice. The solution is easy. It's a legalization of death with dignity. Let's consider the impact of the suffering on the terminally ill patient and their family. People are told that they don't have a choice, that they have to move to where it's legal to have this done, and if that's not an option for them, they have to resort to passive euthanasia. That is as easy as refusing treatment, but sometimes that's not even relevant to their disease, and then they must choose to resort to VSED. This is an acronym for voluntarily stopping eating and drinking. It's horrific that people are suffering so much that they have to choose this as their last resort, and that there is not another option. This is Noah Conaway before he was diagnosed with a motor neuron disease. He was told that he did not have long left to live, and that the life that he did have was going to be very painful and a traumatic death. He didn't want this for himself or for his wife, so he decided he was going to fight with the death for dignity. Conway says, "I'm going to die anyways. I strongly believe that we should all have the right to control our lives, and especially the means and the manner of our death." Conway lives in the UK, and he fought very hard in the courts, but he was met with much rejection. This is Conway now. He describes his disease as feeling entombed in his body. He can only move his head and his neck, and he has to rely on this ventilator to help support breathing. One thing that Conway did admit was that he has recently considered taking the ventilator off and passing that way, but he hasn't done it because he's too afraid to die of suffocation. It's horrific to think that people are put in the situation where they're suffering so much that they would suffocate to pass away. In America, we have 7 states that have legalized Death with Dignity Act, including the Washington, D.C. While this is so many steps forward, it's still many steps behind. A questionnaire was sent out to over 800 physicians to get more information about the subject. A lot responded that the main diagnosis for the most common reasons why people seek physician-assisted suicide is a neurological disease, cancer, and AIDS. Patients described that they felt like a burden, that they were losing control of their independence, and some of them were financially suffering because they did not have adequate health care and therefore couldn't even afford the terminal care that they had. Out of 156 people who requested physician-assisted suicide, only 38 were given prescriptions to help pass peacefully. So what's a solution to help people pass peacefully and to minimize the suffering? The solution is to legalize the Death with Dignity Act. Stop patients from having to move and uproot their life and to fight for their rights. To legalize an act like this, though, there must be a lot of control. There are several steps that lay down a foundation to help decide if you believe physician-assisted suicide is right or wrong. The patient should have an incurable disease that's going to bring a lot of suffering. They must look at the comfort-oriented measures and make sure the suffering is not due to the fact that there is improper comfort care. The patient must repeatedly request this decision and do it so with confidence and clarity. There must be no distortion, for example, to medications or depression. The relationship between the doctor and patient should be meaningful. Ideally, the doctor should be there from the point of the diagnosis all the way through the patient's journey to fully understand. After everything is looked at and the eligibility is approved with age and all the other legal rights, another physician should be consulted. He should go through the evaluation and interview with the patient and also approve. There should be extensive paperwork. The family should be involved if the patient chooses so, and spiritual counseling should be represented if they need it. With these solutions and these special steps, patients can take back the control in their lives and the disease not have the control in their lives. Death with dignity allows terminally ill patients to have autonomy and control over their disease and lives. It's easy to dismiss the importance of this problem until it affects you or your loved one. But it's important that we all stand together and fight for our rights for those that it does affect. Many people have had to suffer and die in bad situations, scared and in pain. Conway points, it's not a question of whether I'm going to die. It's a question of whether I die with or without suffering and on my own terms or not.